Hello, everyone. Welcome to Thursday. I'm Randy Murphy, Mobile County Health Department epidemiologist, here to give you just a brief update on the effect of the COVID-19 pandemic on Mobile County. This morning, worldwide, we crossed the 5 million threshold for the number of COVID-19 disease around the globe, with 330,000 deaths. In the United States, just over 1.5 million COVID cases and 94,000 deaths. In Alabama this morning, there were a little over 13,000, so 13,119 cases of COVID-19 disease with 529 deaths. And in Mobile County, our detailed daily report is on 1,838 cases of COVID-19 disease, with 214 or 12% hospitalized and 107 or 6% died with COVID-19 disease. We continue to see just over 26% of our cases occur in the 65 and older population, and very few children affected. Those 16 children between the ages and 0 and 4 have been diagnosed with COVID-19. Some of the other characteristics that we report on, about 16% of our cases are known to be healthcare workers. Around 27% of the cases are associated with outbreaks at long-term care facilities. And we know that about 20% have recovered, but we are working on changing the definition of how we define recovered, because there's very sparse data on that. So we're not always able to call patients back time and time again to find out that they're no longer ill. Sometimes that's just a one-time phone call. So we're doing some other things to try to estimate the full number of recovered. And then we have about 9% that have tested positive that had no symptoms of COVID disease reported to us. When we look more closely at the hospitalized cases, so people with COVID-19 who were hospitalized are older, so 90% of them in the 50 and over category, with 60% over the age of 65 or older. And about 40% require intensive care while they're in the hospital, and around 22% require mechanical ventilation. Of the 107 that have died, 90% of them are 50 and older. So again, we see a much worse outcome with hospitalization and deaths in the older categories. For those age 65 and older, they make up 80% of our COVID patients who have died. Of the people have died, 86% of them died in the hospital, and the other 14% died in long-term care facilities, and 95% of them had underlying conditions. So again, the greatest risks include those that are 65 and older, or persons of any age with underlying conditions. We're still seeing on average around mid-30s to low 40s of the number of cases added per day. When you look at the chart by day, it jumps around a lot. But if we smooth that curve or that chart using a 7-day or a 14-day moving average, we see that we have over the last 14 days, between 33 and 43 new cases added each day. And we will begin showing that chart with the moving average overlaid, hopefully beginning after the long holiday. I'm also excited to see if next week, if we might be able to share some more information with you on the geographic spread. GIS professionals at the City of Mobile and the Mobile County government agencies are gratefully, I'm grateful for, they're assisting us in displaying that data, because they have that expertise there, and they can really do a good job with that. Right. I want to address, if you have been watching TV at home, you know that at 2 o'clock, the governor and the state health officer provided information on the amendment to the Safer at Home order. So the amendment goes into effect on May 22nd at 5 p.m. and ends on July 3rd at 5 p.m. And some of the new updates include entertainment venues such as arcades, theaters, and bowling alleys are open, subject to social distancing and sanitation rules and guidelines. Also, athletic activities like practice. So practice is allowed beginning on May 23rd. Competition allowed on June 15th, all subject to social distancing and sanitation rules and guidelines. Also, educational institutions may open on June 1st, subject to social distancing and sanitation rules and guidelines. Child daycare facilities may open subject to social distancing and sanitation rules and guidelines, and summer camps may open subject to social distancing and sanitation rules and guidelines. So if there is not a date specified, then the order goes into effect on May 22nd at 5 p.m. through July 3rd at 5 p.m. So there is much that is staying the same. So again, individuals are encouraged to stay at home. Employers may open their businesses subject to sanitation and social distancing. All retail can open subject to 50% occupancy rate. Medical procedures are allowed unless prohibited in the future to preserve the medical equipment necessary to diagnose and treat COVID-19. Senior citizen centers can still provide meals through curbside pickup or delivery, but regular programming is still suspended. Hospital and nursing homes still must implement policies to restrict visitation. Non-work gatherings are allowed, but you're still required to maintain 6 feet of distance between persons who are not from the same household. Restaurant, bars, and breweries may open with limited table seating, 6 feet between tables, and subject to sanitation and other guidelines. Athletic facilities may open subject to social distancing and sanitation rules. Close contact service providers like barbershops, hair salon, nail salons, and tattoo services may open subject to social distancing and sanitation. And then beaches are open with no limit on gatherings, but you must maintain a 6 feet separation. So reach out. The new order is available on the State Health Department and the governor's website, and there will continue to be, I'm sure, some sort of more information that on the new updates, things that are open now that have not been open previously. All right, on to some questions. Let's see. One from Facebook: if someone has a relative in a nursing home that's been diagnosed with COVID-19, can the person take their relative out of the facility and put them in a hospital? I don't know the answer to this question, actually. I believe that a provider has to order movement of a patient, but I don't know for sure. So let me do a little research on that one and try to get back with you on that tomorrow. Someone asking, there's a 0.4 infection rate, means 1,000 people.
That's a repeat.
Is it? Okay, thank you, Mark. Sorry. I think I probably said I was going to look into that and did not. Okay, apologies. How will you know if case rise? Since they are still doing that, cities should at least require masks. So again, county-wide, the state health officer ordered, made it a strongly recommended to wear a face covering anytime you're in public. We are still strongly recommending that happen, but we know there is variance and uptake in compliance with that request. And yes, we will know if cases rise because of some of these new restrictions. We'll just keep an eye on the case count as we go over the next couple of weeks. Also a question about why the reported number of people tested in Mobile has been unchanged since Sunday. The number listed has been 15,435 for 3 days now. I don't know the answer to that question. That dashboard is run by the Alabama Department of Public Health, but we will certainly bring that to their attention. It did go up. It has been updated now. Okay. So Mark Bryant, our PIO, our Public Information Officer, say that got updated today. In regard to swimming pools, chlorine kills virus, doesn't it? And the answer to that is yes. I think at like swimming pools and any outdoor recreational activity, there's still just a concern about people having a false sense of, like, well, I'm safe if I'm in the pool with the chlorine, and that's not necessarily correct. Again, the virus is spread by respiratory droplets, so even when you're at the pool, you need to maintain that 6 feet of physical distance between you and others that are not in your immediate household. Here are some media questions. Can you get coronavirus from an open skinned wound? I don't think so. But again, there is a lot of science coming out on this brand new virus that we're learning about. There has been, and there probably is, transmission through of respiratory droplets entering your eye, but entering a cut or a scrape, I wouldn't think so. But I guess if a respiratory droplet, if you coughed into a cut on someone's arm, usually it has to go through a mucous membrane. Generally, the blood barrier would not allow the virus in. But if I hear differently from that, I will eat my words and change my answer when the science is out there. So let's see. Montgomery County says they're running out of space in ICU space and ventilators. They have far fewer deaths and confirmed cases in Mobile County. Yeah, there are fewer hospitals and fewer hospital beds in Montgomery County than in Mobile County. So I think that we have greater capacity here based on our larger population than in Montgomery County. Let's see, can you speak to what the trends are, case growth and deaths are in Mobile? Again, in the last 14 days, we have seen a slight sort of leveling or stabilizing of the number of cases that are reported on average to us. And in the last 7 days to 10 days, it had dipped down just a little bit further. But we will start to see the effects of the relaxation of the safe at home order only in the next week or so. Because again, with the incubation period of 1 to 14 days, what we're seeing now, as far as the numbers reported, reflects the transmission that was happening between 2 and 14 days ago. So it'll be a week or 2 weeks or 3 weeks before we see the effect of the relaxation of the order, how that impacts transmission in the community and the number of positive cases that are reported to us. Has Mobile County seen a case of MISC yet? So this stands for multisystem inflammatory syndrome related to COVID-19. I have heard anecdotes that there have been maybe 1 or 2 children that may meet the definition of MISC. This has just now begun, this syndrome has just begun to be recognized, and the reporting and evaluation of people less than 21 that may be affected by this are just now starting to roll out. So for example, just today, CDC released the case investigation form and the case reporting form for patients that have MISC or are thought to have MISC. So we will be learning more about this as more and more information is gained, and as CDC starts to provide guidance and resources to physicians who may be treating children, or I think it's less than 21, that may have this unique and disease related to COVID. So there will be much more information to come on that. I'm trying to read this one. So there's a question about how many have recovered from the virus? Only around 350 or so. Does that mean that the balance of them still have the virus in Mobile County? And the answer to that is probably not, but we don't know. So we're trying to, again, usually a public health investigation is a point in time conversation with the patient. So we contact them to conduct the interview, and we often do not know what happens to them in the days or weeks following that first interview. We're trying to do more than that by calling them at least every other week to find out if they have recovered or if they're still ill or if they have become hospitalized and died. But it's a really slow process. So what Alabama Department of Public Health is doing, and what we will do as soon as I can find the time to get it programmed, is start using a different formula based on the science of about the longest length of time between presumed infection and endpoint, so recovery or hospitalized or died, and try to come up with some more, not to say accurate because it's still a little bit of a undefined situation, but try to see using a case definition that the state will begin using to classify people as recovered. But I think the good news is that, between the number that are hospitalized and the number that die, that only is about 20% of our cases, which means that 80% or 80 to 85% of people who get COVID-19 will survive. If you are young and you're healthy and you have no underlying conditions like diabetes or obesity or immunocompromising conditions, you will likely survive and have a mild illness that can just be dealt with at home. So I think that's the good news, that most people will recover from COVID-19. But we still are asking for the young, healthy people to adhere to the social distancing guidelines and the information about disinfection and sanitation, because it's those of us that are younger and healthy that may get infected and not realize it. We may have a mild infection, and if we are not following the cover your face recommendation, or if we're not respecting that 6-foot distance and not washing our hands and not covering our cough, then we are likely the ones that will spread it to older people or those with underlying conditions that we may not even recognize, and spread our germs to them and then lead to those severe case complications and deaths. So I don't want to do that. I don't want to accidentally infect someone with COVID at the grocery store because I got too close to them and I didn't realize that they were maybe battling cancer or had some other underlying disease. So it's my personal choice to strictly adhere to the public health directives, and I really am begging that everyone take on that personal responsibility to keep our most vulnerable community members safe from harm of COVID-19. So with that, I'll end and talk to you again tomorrow at 2:30, and I'll try to get these questions answered that I promised to do and didn't before today. So more on Friday. Thanks.